What we do here matters, because what we don't do matters even more.
We need to continue to push, and we at ADAO are going to continue to push the Surgeon General of the United States.
As you know, the United States continues to use asbestos, and that indeed is a barrier to others stopping its use.
The most horrific part of this whole story is that it is preventable.
My name is Charles Levenstein. I was a professor of work environment, retired in 2003, and at that point the teachers union discovered I had been a member for all those years, and so they asked me if I would be on the health and safety committee for the union, and I said yes. It was interesting and I had time, so what the hell, right? So, three things. Linda asked us to say what three things do we really want to get out of this. Here are the three things. One, passing a law does not solve the problem. Right? Two, management in schools or elsewhere may not be competent to manage highly hazardous technology. And three, only vigilance by workers, teachers in this case, and users, parents, can ensure compliance, and sometimes that may not be enough. So, what happened was there were a set of questions which came up as I took over the chairmanship of this committee. AHERA was passed basically because when there was a panic over asbestos in the schools, a lot of schools started ripping out asbestos willy-nilly and causing more problems than if they had left it in place. And so the public health people said, let's figure out a way to manage this in an orderly way. And AHERA was the answer to that. AHERA was an attempt to manage asbestos in place. Has it worked? And is it a good model for the regulation of health hazards in schools? Because we keep on running into one after another. In fact, this discussion was provoked by PCBs in schools, by lead in schools, which has not been solved, a whole range of problems, which, so we were trying to figure out, well, is AHERA the model that we should pay attention to? How big a problem is this? We're talking about 53 million children and about 6 million adults who spend a substantial amount of the day in schools. NIOSH says its education sector is the second largest industry in the United States. In Massachusetts alone, which is mainly what this paper is going to be about, the talk is going to be about, over 72,000 teachers were employed in public schools, K through 12. So, this is what the law required. Conduct comprehensive inspection for asbestos-containing building materials in all the schools. Based on the comprehensive inspection, develop and implement an asbestos management plan for each school. Conduct follow-up inspections every 3 years. Take appropriate action to repair, encapsulate, or abate asbestos as recommended by the asbestos management plan. Train school personnel to conduct periodic reviews of asbestos-containing materials every 6 months. Maintain copies of the plan, of the asbestos management plan. Notify parents, teachers, staff, and employee organizations annually of the existence of the management plan and reinspection reports, and then notify parents, teachers, and employee organizations about any abatement efforts. So, in Massachusetts, which is a relatively wealthy state, and schools of very high reputation, the Department of Environmental Protection did a survey of schools. This is between 2003 and 2006, and they found a whole raft of problems in the schools. Perhaps the one that we're most concerned with is that the asbestos management plans, the reports were not on site, not updated, failure to notify the Department of Environmental Protection of asbestos removal or demolition work. So, the schools in Massachusetts. When the EPA was in charge of enforcing this law when it was passed, but it could, in effect, give a waiver to a state, enabling the state to enforce the law. So Massachusetts applied for a waiver in 1998, and since that time, the Division of Occupational Safety was responsible for enforcing AHERA. They adopted all the federal rules except being able to fine the schools, right, which is interesting, but the part of it is no unfunded mandates in Massachusetts. So they could inspect. That then left it to EPA to do the fining. All right? So there are other waiver states. You may be from Connecticut and Rhode Island, Colorado, Louisiana and Utah, Maine, Massachusetts, Texas and Oklahoma. There may be some since the state, but that's the latest I was able to track. So the problem of state enforcement of federal law is one that is not uncommon. Then a report came to my attention from the Department of Public Health. This had not yet been released. They identified 57 school employees diagnosed with mesothelioma between 1987 and 2008. 34 teachers, including 2 principals and 1 teacher's aide, 23 other school employees, 25 cases in which the school was actually identified, and 10 cases in which the known asbestos exposure was identified. But basically, because of freedom of information or privacy considerations, we could not find out all the schools. So we're sort of like fighting with them now about digging that out. Now, these school workers were probably exposed before Massachusetts took over AHERA, because the latency period is enough so that this is not evidence that AHERA was working or not working. It's just that it's worth paying attention to the schools, because there are cases of people who are not working with asbestos, who have no reason to be exposed to asbestos, we're being exposed and we're getting disease. It may not even be at the school for all we know, but we thought, in effect, these were sentinel health effects. What's going on is, if you see a case of mesothelioma in a teacher, go and investigate the damn school, right? Instead, the epidemiologists were calculating odds ratios, and we said, I don't want to know odds ratios. The odds ratio for teachers was 1, right? Which meant basically there's no problem. It's much worse for construction workers, for carpenters and the like, which of course we knew, right? But the notion that it's okay to have a certain level of mesothelioma in teachers is a bizarre idea. It should trigger an inspection. And they agreed eventually, after being nagged and beaten on. This is someone who was writing about federalism and environmental policy, and basically in reviewing all of the different kinds of this federal-state relations. What she says is that AHERA implementation is like many other programs that began in earnest, as you said, ripping out a lot of asbestos initially, right, and then fade as policymakers perceive that they have solved the problem and new issues emerge that require their attention. Federal-state relationships in asbestos are best characterized as falling somewhere between cooperative but autonomous and coming apart with avoidance. So, Massachusetts became a waiver state in 1998. DOS accepted the responsibility for doing it. We used the Freedom of Information request to get the summary reports. Every year they had to file with EPA. So we didn't get the actual particular inspection reports, but we got the sum at the end of the year, and we got them from both EPA and from the state. So the reports had both complaint inspections and random inspections. For the random inspections, for the 10 years, we found, on average, about 90% of the audits resulted in the issuance of a non-compliance note, letter of non-compliance, which meant 90% of the schools in the state, in one fashion or another, were not meeting the AHERA requirements. So, what kinds of problems? Failure to keep required records, to verify that when asbestos contains, whoops, here, that, wait, here, yeah, failure to keep required records, failure to ensure that maintenance custodial staff receive awareness training, failure to notify parents, teachers, employee organizations. Are these mere paperwork violations? Because what happened was we then went into a meeting with the people from the Department of Safety, and they said, oh, well, this is just paper. Don't worry about it too much. We said AHERA could not possibly be enforced by EPA or by the state. They simply didn't have enough inspectors. The paperwork requirements were critical. AHERA enforcement depended on teachers and parents knowing what was going on, because they then could hold school districts and superintendents' feet to the fire. They're essential. They're not incidental. Notice in the UK, the teachers' union there does not have AHERA, but their demands, have not been successful, but their demand is get it out. Get the asbestos out of the schools. And get it out because you can't have encapsulation or labeling where there are kids around, because kids will disturb anything in sight. So there is no safe way to do this. So that's their approach. We, however, were dependent on the existing law in the United States and in Massachusetts in particular. As a result of our nagging and yelling and making this thing public and finally making a scandal of it by going on television, there was a change in some of the leadership in the Department of, what was the Department of Safety is now the Department of Labor Standards. A new sheriff in town, Heather Rowe, who is terrific, and she did this amazing thing. She sent out a letter to every school district and said, we want to see your audits. And send them in. And if you don't send them in, you will be prioritized for inspection. Which it seemed, which we were actually impressed with that. So that was August 2011. So we waited a reasonable amount of time, and then we asked the Department of Labor Standards the following questions. What percentage of school districts responded to your letter? Of those school districts that responded, how many were in compliance? Are you actually going to prioritize the non-complying, the non-reporting schools, and did you do it? And how many inspections, what's that all about? Is this the only time you're going to do it, or are you going to do it on a regular basis, or are you going to ask them for the reports? What are the Department of Labor statistics on the AHERA random inspections? What are the results? And how might we in the teachers union help you out, if you want to do enforcement of this thing? Finally, is the Department of Labor Standards in touch with the Department of Public Health? Because the Department of Public Health is discovering all these cases of mesothelioma. So are you talking to each other? Are there other occupational health initiatives that DLS has been involved with that we could help out with? And what have you got in terms of resources to enforce all this stuff? So just the last one I will mention briefly. They get $110,000 a year from EPA to enforce the rules. Just to give you an idea what that looks like, I said in the when I sent you the overheads, this is what I said. We were meeting with them March 5th. So we met with them March 5th. So I want to give you some answers, right? I don't have it on this overhead, so I just have to tell you this. There are 2,649 schools, public and private, not-for-profit, in Massachusetts. They received reports from 1,670. That is roughly 65% of the schools. The rest did not reply, right? Of the 1,670 schools that replied, 1,000 of the reports were severely deficient, all right? 665 additional ones had minor deficiencies. There were only 5 reports that were fully compliant with the law out of 2,649, okay? 5 reports. So, 21 schools were prioritized for inspection. Those are the ones that actually sent in the reports because they had severely deficient reports. 4 were prioritized for failure to submit reports. 4 out of the about 1,000 that didn't submit reports were prioritized. A large number of the deficient reports, however, were attributable to a limited number of audit firms, that is, licensed asbestos removal companies, all licensed by the Commonwealth of Massachusetts to conduct these activities. So DLS did, I think, a very clever thing. That is, they brought in those companies. There were maybe a half a dozen of them. And that's where the fines went. They could not find the schools, but they could find the audit companies which had written the bulk of these deficient reports. And then they said, you have to go back to the school and tell them that you will redo the report and do what you were supposed to do, and you can use the fine, that you cannot charge the school, but you can use the money from the fines for the remedy of the situation, which it seemed to me was a good thing to do. On the other hand, DLS did not inform the schools themselves. They told the consultant was supposed to do the informing. So, what we are doing next, I'll finish now, we are informing the union membership about what we found out at the meeting. We'll contact local unions where the schools did not even respond to the letter. We'll inform the membership and state legislators about the offending environmental contractors, and we will go back to the media. DLS does not want us to go to the media, but apparently that's the only way that you can make things happen. Now, the last non-slide I've got is called a human rights campaign. A truly humane society puts first things first. Ban and remove asbestos. Protect the children, protect the staff, protect the community. So, that's my report. I have to say, having listened to the talks, that I'm really angry. I don't know if you're angry or not, but this is really, it is very upsetting to hear about something that's supposed to be happening, and that there are laws and there's federal agencies and all the rest, and it's not happening. And it seems to me that the notion of a broad-based, popular campaign, which could very well start with an organization like this, is really necessary. And this is not just lobbying or getting little laws. This is like a big fight. One of the speakers the other day said that there was a big difference between lead and asbestos, and the treatment of lead and asbestos. Well, lead was embedded in community fights, community after community. They were worried about their kids, and they were worried about their kids' mental capabilities being destroyed, and they fought like hell, and they're still fighting like that. They do not rely on the federal government or on the academics to solve this problem. They are pissed. Sorry, that's a technical term. It seems to me that you have a right, you have a real right to be very, very angry, and we should be talking a people's movement, and not little solutions.